The broadcast is now starting. All attendees are in listen-only mode.
Welcome to Mercy Medical Center's live webinar about breastfeeding. If your computer doesn't have speakers and you wish to access the webinar toll-free, click on the additional numbers link under audio. Joining us today are Linda Vine and Linda Klein, Mercy Birthplace Certified Lactation Consultants. After the discussion, they will take questions from our audience. To submit your questions throughout the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with white arrow. Your questions will be anonymous, completely confidential. So let's get started. Lynn?
Breastfeeding is the best gift that you can give yourself and your baby. There are many medical organizations that support breastfeeding. One would be the American Academy of Pediatrics, the American Dietetic Association, and the American Academy of Family Physicians. They recommend that babies be exclusively breastfed for the first 6 months and that breastfeeding continue for at least 12 months and thereafter for as long as mutually desired. Breast milk is human milk for human species. How many mammals do you know of that feed other mammals or feed their mammals, other mammals' milk? It's easily digested. It's perfectly matched for your baby. And with the antibodies that are in that milk, there are 6 million germ-killing cells in just 1 teaspoon of milk. There's many benefits for mom. First of all, as soon as the baby's born, it helps to get that uterus back to its normal size. It helps to cut down on excess bleeding after delivery. It's always there, it's always ready, and it's of no cost to you. Breastfeeding is a beautiful and intimate way to bond with your baby. The skin-to-skin act of mom and baby together also helps with brain development and increasing and helping our relationships later on in life. It contributes to a very loving relationship. All breasts can make milk, and almost every mom can produce enough milk for their babies. And the way it's made is there's little milk-producing cells called alveoli that are connected to little ducts that travel out to the nipple. And there's little openings where the milk comes out. The brown part around your nipple is called the areola. And then basically what makes the size of our breast is actually the fatty tissue in our breast. The way that milk is made is there are 2 hormones that are stimulated from the pituitary gland in the back of our brain. One of the hormones is prolactin, and prolactin is responsible for milk production. The other hormone is oxytocin, and it's responsible for acting upon the cells to kind of help squeeze that milk out of your breast. And that also is responsible for the sensation that you can have with breastfeeding. Oxytocin is also the hormone that helps us to get real sleepy and relaxed when we're nursing our baby, and it also increases the affection that we have towards our baby. Colostrum is the early milk, or the first milk. We can call that liquid gold. It's high in protein, it's easily digested, and it also helps as a laxative. It clears out the intestinal tract of the baby and also helps to loosen up that mucus that the baby has. The amazing thing about colostrum that you'll never find with formula is it helps to coat the stomach and the intestines and it protects against the invading organisms. It provides many antibodies and immunities that help to protect our babies from diseases. Colostrum is also very thick and very low in volume, and a lot of times moms think that they don't have enough milk, but their bodies produce just enough for what the baby needs. Within 48 to 72 hours, our mature milk comes about, and it also, our volume increases. Sometimes it takes a little bit longer, just depending on if breastfeeding was initiated immediately after birth or if mom did not nurse the baby enough. At Mercy, we have lactation consultants that help to provide support, confidence, reassurance, and peace of mind. We have 5 international board-certified lactation consultants that work 7 days a week, and we also provide home visits for our moms when they are discharged from the hospital. Here at Mercy, we have a breastfeeding group that meets once a week at 10:30 on Wednesdays. Moms come and bring their babies and other children that they may have at home. It's a great group where you can meet with other moms and talk about your experiences breastfeeding, get ideas and support, and also develop new friendships. In the breastfeeding relationship, it's very important to, number 1, be calm, to get comfortable, and hold your baby close. We have different positions with breastfeeding. The cradle hold is usually the hold that moms have when their babies are a little bit bigger, and babies are, it's a little bit easier for them to grasp onto the breast and to hold on to it. Immediately after birth, we usually help to position the baby in the cross cradle position, because there we can help support the head and support the breast in the baby's mouth. The side lying position is perfect for where it's in the middle of the night and you're tired, and daddy can get the baby, bring the baby to bed, and you can lay in bed while that baby is nursing. And then when baby's done, daddy can take the baby back to the bed, make sure the diapers are changed, and you haven't hardly missed any sleep. The football hold is another hold that we do pretty much immediately after delivery, especially if mom has had a C-section and doesn't want to have any extra pressure on her incision. So we hold that baby close, support the head and neck, and oftentimes we also can hold and support the breast as we're holding the baby close to the body. Now, how do we know if baby wants to eat? Well, there are some early hunger cues. Babies will start smacking their lips. They might be opening their mouth. They put their hands to their mouth. They also start sucking and making little noises. They might be wiggling around, moving their arms and hands, or fussing and fidgeting when they're sleeping, or turning their head from side to side. In other words, you want to wait. You don't want to wait until they start crying loud. You want to make sure you kind of tune in to those early signs of when your baby is hungry. How do we know if baby's had enough milk? Well, a lot of times we can see little milk coming out of their mouth. We can hear them gulping and swallowing at the breast. When they're done, they're usually very sleepy. Their body starts to relax. And when babies have those tight little fists, when they're really hungry, they'll start to relax and open their fists. And you'll notice that they no longer have the frown on their forehead. Proper positioning and latching is very important when breastfeeding. Number 1, mom needs to be comfortable. Make sure that you're supporting your back, your neck, your arms. Use pillows to prop up under your arms. Hold your baby close to your body. You need to align the baby's nose with your nipple. And hold your breast in the C position, and make sure your fingers are not covering the brown part or the areola around the nipple. You want to place your nipple above the baby's upper lip, and as you stroke the nipple down, That will help to promote the rooting response when the baby will open his mouth wide. It's very important to make sure that the baby's mouth is wide open, and don't let him latch just on your nipple. He needs to be covering all of the nipple and a good share of the areola. In other words, about a finger's breadth from your nipple, he should be covering that part of the areola. The latch-on takes a while to learn. Be patient with you and your baby, and you'll get it figured out, and before long, it'll take just a second to get him latched on. So he needs to have his mouth wide open. His tongue needs to be down because the nipple needs to go over the tongue up towards the roof of the mouth. Once he opens wide, you want to make sure your nipple is pointing to the roof of the mouth, and then you pull him in gently, but you want to give some good counter pressure to hold him in position so he doesn't push off. You may need to support your breast like she is here in this picture to keep the breast into the mouth, especially in the early stages. Later on, babies can keep that breast in their mouth without any problem. Now, how do I take the breast out of the baby's mouth? You want to make sure you're not just pulling the baby off because you could cause some damage to your nipple. So you want to slip your finger in between his lips and your nipple to help break that suction first, and then you can go ahead and take him off. These are a few examples of having a correct latch-on. And this is a great picture because it shows how the baby is covering pretty much all of mom's areola. Baby's mouth is wide open. As you can see, his lips are flanged out, or we call those ducky lips. The tongue is over the lower gum. You can't see that, but that's what's going on. The baby will stay in position, and you will hear him swallowing. It's like a soft K, but you will also feel him tugging at your breast, but it should not be painful. Oftentimes, initially, you might feel a little discomfort, but after just a couple seconds, that discomfort goes away. And if you look back by his ear, you're going to see those muscles are going to be moving in a rotating motion. If, however, you see dimpling of his cheek close to his lips, that shows that he doesn't have a really good latch, and probably he's just sucking on his tongue. Once your breastfeeding is established, the best way to keep making your milk is to keep emptying your milk. So the more you breastfeed your baby or pump, the more milk you're going to make. And we call that supply and demand. So the more you empty, the more your breasts are going to make. How do we know if baby's getting enough? Well, first of all, your baby's going to gain weight. In the first 3 days of life, they usually lose several ounces. But then about day 4, when your volume increases, babies start gaining about an ounce, a half ounce to an ounce a day. So it's a very important clue that your baby is getting enough to eat. So how often do I feed my baby? Well, you need to feed your baby at least 8 to 12 times in 24 hours. So that's approximately every 1 to 3 hours with 4 to 5 hour stretch, and hopefully at night. But a lot of times those little babies like to do that during the day. But remember, babies do cluster feed, and what that means is they might want to nurse and nurse and nurse for 3 hours straight, and then they take that 4-hour nap, and that's okay. The most important thing is to remember to feed your baby when your baby needs to feed, but don't let them sleep for a long 4 to 5 hour stretches, because then your baby can run into problems where they're not getting enough feedings. So pay attention that your baby is getting at least 8 feedings in 24 hours. So how do I know if we're done feeding, if baby has had enough? Baby slows down with the sucking. Your breast will be softer, and your baby is sleepier, and sometimes you become sleepy. And then your baby will come off on his own. And remember when I said you can actually hear that swallowing? It's like a soft K sound as baby is suckling at the breast. So baby should eat at least every 1 to 3 hours. should have adequate wets and stools. And we have a little cheat sheet that we give all the moms that tell them how many wets and stools you should have in a 24-hour period. And like I said, babies should gain 1/2 to 1 ounce a day. And you'll notice the difference as your baby, and it's really important to pay attention to what your baby looks like. Their little cheeks should start filling out, their little legs and belly should start getting chubby. And this is kind of a repeat of what we talked about as how you know that your baby's getting enough milk, because it's very important. The breasts don't have any markings. We don't know how much milk is in your breast, but we can know because baby is satisfied, content between feedings, and is starting to gain weight. Sometimes there's some problems with breastfeeding. One would be you can get sore nipples. They can get cracked. You could possibly have some blocked ducts or mastitis. You can avoid these things by proper latching and frequent nursing, and we can show you how to do that when you have your baby. Storage of breast milk is for moms who choose to pump when they're away from their babies. And we will give you the resource of how long you can store this breast milk and how you need to take care of it. There are different resources, so you might find just a few discrepancies in how many days or how many hours, but they're all basically the same. And just make sure you ask your nurse or healthcare provider, and we also do provide that information when you come here to the hospital. Fathers are very, very important in the whole process of having a baby and deciding to nurse your baby. It's important to include dad, and just because mom has decided to breastfeed the baby certainly doesn't mean that dad doesn't have a very important role. Babies need more than just feeding. They need to be held close, and not only can mom do that, but dad can do that as well. The skin-to-skin that the baby needs to do at breastfeeding can also be done by father, and dad, he can help mom a lot just by supporting her in her decision to breastfeed. We would like to invite you to help to celebrate World Breastfeeding Week, which is usually the first week of August. And Mercy Medical Center has had our breastfeeding group for 10 years. So we would like to have a celebration for the 10 years that we have met together. So on Saturday, August 7th, 2010, we are going to have the Breastfeeding Support Group picnic, and it will be held at the Lagoon Pavilion in Noel Ridge Park at Cedar Rapids from noon to 3, and we are planning on providing a lunch for you. So please come and attend our celebration.
Thank you, Lynn. To remind our listeners, questions can be submitted from the box in the upper right-hand corner of the screen. Okay, our first question is, what if you are on medication that might be transferred to the baby through the breast milk?
Well, that's a really good question. We usually have moms give us a call, and if they are on a medication, we have a book that has medications and whether or not it's compatible with breastfeeding. And it's surprising how many medications are compatible with breastfeeding. And a lot of times If it isn't, it might be at a certain time when it peaks, and so that might be the time that you need to avoid. So we just have our moms give us a call, and we will look that medication up and see if it's compatible. And a lot of times we can even find out if there is a medication that is better but actually would do the same thing for you. I hope that answers that question for you.
We have another question. What if I don't think my baby is getting enough milk?
We will always follow up with our moms after they've delivered. We do a home visit 2 days after discharge, and we'll weigh the baby and just kind of evaluate how the feedings have been going. If babies are not gaining, then we try to follow up closer and work out a plan of care, how to increase mom supply, or if we need to supplement or not. The most important for knowing if your baby is getting enough is making sure, number one, you're latching on appropriately. Number two, that baby is feeding enough. And number three, that baby is having adequate wets and stools. And a lot of times it's just a little thing like, well, you've only been nursing your baby 6 times in 24 hours. You should bump that up to 8 to 10 times in 24 hours.
We have another question. I had sore nipples the last time I breastfed. How can I prevent that from happening again?
Sore nipples do happen, but it's usually because the baby has not latched on appropriately. And earlier on in the presentation, we went through how it was important that the baby not only cover mom's nipple, but also a good share of her areola. The mouth should be compressing the areola and never the nipple. And one thing that I find is that it seems like during those night feedings, when mom is pretty sleepy and she's not paying close attention to the feeding, baby can slip off a little, start sucking and compressing the nipple, and that's where we get those cracked and sore nipples. So I just cannot emphasize how important that latch and holding that baby in close helps to prevent that. If your nipples do get sore, we do recommend at the end of each feeding to express your own colostrum onto your nipple, allow that to dry, and then usually we recommend a purified lanolin to put on the nipple to help to keep them soft and help them to heal. And also to avoid like wearing breast pads that are soaking wet, but to try to keep it dry. And if you were to have more problems, you could always consult with one of our lactation consultants.
Do I need to avoid any foods when I'm nursing?
That's a good question. There really is no food that you need to avoid. You kind of need to pay attention to your baby. Babies can react to certain foods. A lot of times, surprisingly, it's dairy. But the big signs that show that it's a problem with food is if baby is very fussy, gassy, spitty, has foul-smelling stools, and you notice baby has a bad diaper rash. Then your baby probably is, you're probably eating something that can cause your baby to have some kind of reaction to that. The number one culprit is dairy. The other things that might be a problem is high acidic foods, like if you were to eat a lot of oranges or orange juice or tomatoes. Sometimes your wheat products, and of course if you have any peanut allergies in your families, that you might want to avoid those.
We have another question. I'm nervous about nursing in public. Do you have any suggestions?
That's pretty common, and I think it's really important to be conscientious not only of your own feelings but of other people's feelings. The first thing I want you to know is that in the state of Iowa, you have a legal right to breastfeed in public. So if you were out shopping or out to eat at a restaurant, it would be okay to nurse your baby in public. I think what you need to do, however, is kind of plan ahead, like wear the type of clothing that would help it to be conducive to breastfeeding, where you would have, where you could cover yourself up. Sometimes women use just a blanket to cover themselves up. I also tell moms it's a good idea to plan where you're going to be. If you're shopping at the mall, you can go to the women's lounge to nurse your baby. You just try to find those places where you can have some privacy, and just be aware of those around you so that you can cover yourself up. The other thing is, I think that's it.
We have another question. How long should I nurse my baby? 6 months, 12 months? Any advice here?
Well, as I said early on in the presentation, the American Academy of Pediatrics recommends nursing our babies exclusively for the first 6 months of life, and then after that, at least for 12 months, up to 2 years. Now, if you were to talk to someone in the World Health Organization, or if you were to talk to an anthropologist who studies humans as with other mammals, it's kind of interesting. They recommend that we nurse our young for 3 to 5 years to get the maximum benefit. Now, that doesn't mean that's how long you need to nurse your baby, but it's kind of what works best for you. Studies show that the longer you nurse your baby, the more benefits there are for you and your baby. And the longevity is what helps to decrease our chances of breast cancer, osteoporosis, diabetes, and also obesity. So I think it's really important to realize the benefit not only for your baby, but also for you with long-term breastfeeding.
I have another question related to diet. Should I avoid alcohol while I'm nursing?
Well, of course, we know when we're pregnant, we should not have any alcohol because they don't know what effect it would have on the fetus when the baby is growing inside of you. After you've had your baby, it's okay to have one of those adult beverages, an occasional margarita or a glass of wine with dinner. The rule of thumb is if you're feeling the effects of the alcohol, then you should not nurse. And it's not a good idea to be drinking a beer while you're nursing. However, if you're going out to dinner, going out with your friends, and you have one drink, and by the time you get home you're not feeling the effects, you can go ahead and nurse. But if you decide to go out with the girls, have 2 or 3 margaritas, and you need someone to drive you home, then you need to wait until after you're not feeling the effects. And during that time, if you need to nurse, you need to pump and dump.
Here we have another question. My first child has a lot of allergies, so I want to try nursing this baby. Will that help?
Well, just because you breastfeed doesn't mean that your baby will not be allergic. However, breastfeeding does help to decrease the chances of allergies later on in life. And it kind of has to do with, like I talked about with different foods, you just need to pay attention to your baby. Breastfeeding is definitely the #1 choice of feeding with babies or families that have a lot of allergies. And like I said, the #1 culprit is usually dairy and formula. What is in formula is cow's milk. And some people are even allergic to the soy products. So I think it's just a matter of being careful what you ingest while you're breastfeeding if you have those kind of allergies in your family.
Very good. Another question. Do you have any suggestions for working and going back to work and pumping?
You don't have to start pumping right away when you get home. And usually what we recommend is you can pump anytime. And the best time is if your baby nurses off of one side, it's full, and your other breast is so full that you need some relief. So that would be the time you would want to start pumping. And most moms are home like 6 weeks to 3 months before they go back to work. So during that time, you can start building up a little bit of supply of breast milk before you return to work. And then when you go to work, you need to pump during the time that you're away from your baby, and preferably at least every 3 to 4 hours. And as you do that, then you can help keep your supply going. Some moms, however, have jobs where they really cannot pump, but their bodies can adjust. So you can continue to breastfeed. Your supply can go down if you can't empty when you're away from your baby, but if you can empty every 3 to 4 hours, then you want to give your baby that milk that you pumped that day, the next day when they're at daycare.
When should I introduce a bottle if I'm going back to work?
You want to avoid giving babies bottles in the early stages of breastfeeding. Like the first couple weeks, it's really important for your baby to get used to breastfeeding. And if you give them a nipple too soon, they might decide they like that better than mom. So we usually suggest to have the babies just exclusively breastfeed for the first 2 weeks. And then after that, it's a good idea to maybe begin introducing the bottle. The most important thing is you do not want to wait until the last minute. If you have to go back to work in 6 weeks, you don't want to have to give that baby, when you first go back to work, a bottle for the first time. That might be very difficult for your caregiver. The baby might refuse the bottle. So it's a good idea just to make sure that baby will take the bottle occasionally. However, there have been moms who say, we tried that, we went back to work, and my baby refused the bottle. You just kind of have to work with them. So we suggested around 2 weeks, go ahead and introduce that bottle to the baby.
Okay. I've read another question here. I've read a lot about the controversies of pacifiers. What is your experience here?
Well, it's kind of parental choice. Lately, the American Academy of Pediatrics has come out with a recommendation that once breastfeeding has been well established, babies should be put to bed with a pacifier, because they have had studies that have shown that that actually helps to decrease in the chances of SIDS. In the early stages, it's better not to give that baby a pacifier for the same reason. You want them to get used to suckling on the mom's breast and not on the pacifier. However, there are babies that would suck on anything given the opportunity. And like I say, they might even suck on a wall because that's what they have the desire. So you kind of have to figure out what is best for your baby. And then it really is parental choice.
Another question here. I had mastitis with my first baby. What can I do to prevent it this time?
Mastitis is a breast infection. It basically means that some bacteria has entered your breast through your milk ducts and you've developed an infection. So if you do get a mastitis, you normally need to be put on antibiotics, and you need to take the full course, which is usually a week to 10 days during that process. The most important thing is that you continue to nurse your baby. Your baby will not develop an infection. It is just the breast tissue itself that's infected and not the milk. The way to prevent it is, usually early on, mom might have a plugged duct or a tender part of her breast. And you'll just notice you might have just a little hardened, maybe even a painful reddened area on your breast. The most important thing to do is to massage that when you're pumping and or nursing, or when you're in the shower. You want to keep your breast frequently emptied, either by breastfeeding or pumping, and heat compresses are the best thing to help to open that up and to release that. And if you do that, a lot of times you can go ahead and prevent a full-blown mastitis. It's also important to have plenty of rest, make sure you're eating properly, and you're getting enough to drink.
This is my first baby. The question is, do you nurse on both sides with every feeding?
You don't necessarily have to nurse on both sides. If your baby nurses on, say, the right side and you're in the football hold, you're holding your baby in that position, after the baby pulls off, it's a good idea to sit your baby up, burp them, and if they still want to nurse, sometimes you can put them back on the same breast in a different position, because different positionings can help to empty your breast more completely. Now, if your baby was still hungry after 2 positions on one side, then you can go ahead and let the baby nurse on the other side. So you need to pay attention to your baby. Some babies can fill up on one side, and some babies need both sides. I think the most important thing to remember is you want to completely empty one breast before you go to the other breast. Because remember, the more you empty, the more you're going to make. So if your baby is still hungry, go ahead and offer him the other side. But if your baby is content and full and you need to be relieved, grab your breast pump.
Right, we have another question. My sister didn't make enough milk. Will that happen to me?
Well, milk production is kind of interesting, and sometimes it can be hereditary. Occasionally, you might have a woman who has what they call is insufficient glandular tissue, or they don't have a lot of those little alveoli in their breast tissue to make that milk. And we don't know that unless we are working with you. So the number one rule of thumb is to make sure that you're nursing enough, that you're latched on appropriately, and that you're nursing long enough to completely empty your breast. And then we'll follow the babies with the weight. And as long as your baby is eating enough, having adequate wets and stools, and gaining weight properly, then it's not an issue. But it is important to pay attention to those things. I think the number one cause of decreased milk supply is not emptying enough. So the more you empty, the more you'll make.
Another question here, are there any problems with exercising while I'm nursing?
Exercising is very important, and the thing that's important with breastfeeding and exercising is that you don't overdo it, because you can increase lactic acid in your milk, and that doesn't often taste very good to the baby, and so it sometimes can affect your milk. But exercising in moderation is just fine. You just don't want to run a marathon or, spend an hour running 6 miles or whatever, but exercise is important.
A follow-up question to that, what about amount of fluids that you take in? Is that important? Do you always need to have extra water?
We just recommend to our moms that you drink to thirst. You don't want to be dehydrated, and as long as your urine is a nice pale yellow color, then you are hydrating yourself appropriately. But you also don't want to flood yourself. I mean, kind of the rule of thumb is drinking 8 to 10 glasses of fluids a day, and that works pretty good. But just pay attention to your thirst. If you're thirsty, then you drink.
Very good. Another question about pumping. How do you heat refrigerated or frozen milk?
Once you thaw your milk out, and you can do that in a variety of ways. If your breast milk is just put in the refrigerator, you just want to take the chill off. And usually if you just set it in a pan of hot water, or you can use a bottle warmer, that's fine. But you don't actually want to heat the breast milk. You just want to bring it to room temperature. So if you're taking it out of the freezer, once it's frozen, then you want to thaw it out. And you can put it in the refrigerator to start the process. You can put it in hot water, and it's a block of ice, so you need to shake it around so that you're thawing it out. But you do want to bring it to room